And I have a few quick announcements before I hand it off to Summer. We have a couple of new workshops and moving through cancer, which is about exercise and nutrition and other things. You might find it intriguing. That starts on Tuesday at 1 o'clock. It'll be our second meeting. I attended the first one. I thought it was great. And we have a single Alkies group on the same day, which is Tuesday the 10th at 9 o'clock Eastern time. And that is for people who are going through this cancer journey alone without a caregiver. And we have a multiple of people who want to join. And I highly recommend that group. Guided imagery on Wednesday at 3 o'clock. And then we have a second meeting of a group called Young Alkies. It's for ALK Positive members who were diagnosed at an early age, below, I believe, 50. So, and then we also have Mindset Reset on Friday with Heather Smith at 2 o'clock. And that's all I have. So, Summer, take it away. Oh, what? Sorry, I got polling questions. So I always forget those polling questions. I don't know why. So here we go. First polling question, as usual, type of treatment. See what happens, you get rusty. Okay, man, the poll. And the results are in. Alectinib is 50%, and lorlatinib is 22%, and brigatinib is 13%. And next question is length of diagnosis. Come in the poll, share the results, and leading the pack is 3 and 4 years, and 1 to 2 years are all at 29%. 8 to 9 years is 13%, and 1 and under is 10%. And Kirk Smith and myself share the same anniversary, which next month will be 10 years. So give us a high five. I don't know where Kirk is, but and next question. I'm going to switch all the way down to this question, which is our topic today. Is how are you? Are you comfortable about fundraising? What best describes how you feel about fundraising? Kirk has a big smile on his face. Kirk, should we have a party together? I think so. I'll come down to Athens, Georgia,
We would love to
and
have
visit
you.
you. All right, great. All right, so we got. I'm gonna end this poll. Share the results. 42%, not a fundraiser, not my thing. Or I'm going to change that today. 29% a social media fundraiser, emailing friends and family. 23% you share in content and social media. 6% is any way, anyhow. I love fundraising. Wow, that's pretty low. So we're going to go back to um, another one. And Summer, can you unmute and explain this? Do you consider yourself an ALK ambassador?
You're going to learn more about that. So take it for what you will. Do you consider yourself an ALK ambassador? I'll give you a hint. Do you share your story? But Lana, Katie, and Ivon will give more details on this, and then we'll ask this question again at the end.
All right. Okay, I'm going to end this one and share the results. Yes, 58% of us think that we are ambassadors. 24% no, and 82% is what is that? We'll learn that today. And I think I have one more. Yeah, here we go. Last one. Do you share out? Do you share ALK Positive Inc. social media posts? Okay, this is a mixed bag. And the results. and 35% tied sometimes and never. 23% is depends on the content, and 6% is always. So that's my polling questions. And Summer Furman, I'm turning the mic over to you.
Oh, thank you so much, Mark. Hold on, let me get this off my screen so I can see everybody. Hello, welcome back to season 4 of ALKtALK. Thank you so much for joining us. Tonight, we have a full bag of tricks for you. November is Lung Cancer Awareness Month. However, this is still October, but we wanted to rally the ALK community together so that we can hit the ground running on November 1st. You want to be ready for ALK Positive or ALK Lung Cancer Awareness Month. So again, thank you for coming. Tonight, we want to help you make the most out of LCAM while feeling comfortable, maybe stepping out of your comfort zone. We have ALK Positive leadership here to help you with the why Lung Cancer Awareness Month, and the how. Why is it important to be an ALK ambassador? What is an ALK ambassador? And then what's happening with the funds we raise? Why are we doing this? We have tonight with us ALK Positive Inc. Executive Director Lana Smith. She'll be discussing, there she is, give a wave, Lana. She'll be discussing the new look of ALK Positive. Then we have back a little after his year anniversary with us, Dr. Ken Culver, our Director of Research and Clinical Affairs. He is going to give us a sneak peek in what is happening behind the scenes. I like to say while we're asleep, what is the medical committee doing? I can tell you my father is on there and going hard all the time with a full staff of volunteers. So why are our dollars so important? Dr. Ken Culver will help us with that. And then we have Katie Delaney, our development manager for ALK Positive Inc., sharing LCAM resources, a fundraising toolkit, Facebook fundraising challenges, etc. And finally, we have Ivon Diaz joining us from London in her jammies. Actually, not really, but we have Ivon with us. She's a communications specialist by trade. She's an ALK Positive Inc. board member and an ALK Positive patient. She will be sharing our fundraising campaign and helping us leverage our fundraising game via social media. And then we'll wrap up at the end with a Q&A. So thank you again for sharing your Sunday evening with us. And Lana, I'm handing it off to you. But you might be muted because we can't hear you.
Okay, can you hear me? There we go.
Yes.
Thank you. I'm so happy to be here, and thank you everybody who came tonight, because I know when we say the word fundraising, a lot of people will dive underneath their bed. They will run for cover because fundraising is such a big word and it's so intimidating. And we're really here just to help support you and support the organization. We have some really exciting things coming up. I saw a lot of familiar faces on here and then some new friends here on tonight's ALKtALK. So for those of you who I met at Summit, so good to see you on here. And for new friends, I look forward to seeing you at next Summit. So thank you for attending tonight. I think that the information that we have is going to be very valuable for you, whether you're an outright fundraiser or somebody just kind of a backseat fundraiser. So one of the things we want to reveal to all of you first is that we have been working on updating the website and also new branding for ALK Positive. With a generous grant from Pfizer, we've been working on updating our website. So you're going to see a new look. Now, this isn't going to be happening yet. We're January of 2024 we'll be launching, but we wanted to give you a sneak preview. So as you see these new color schemes coming in, you guys can get excited. And I also wanted to explain some of the strategy behind it. As you can see, our branding colors are changing to the blue and the green. We've also incorporated a plus sign with the ALK Positive logo. We're really excited about that. What that allows us to do is that with different access for different marketing and promotion things that we're putting out there, it gives us an opportunity to utilize just a little different look. As you guys know, if you don't, but most of you probably do, is that blue is kind of the industry color for lung cancer. So we thought we would stay, you know, within those industry kind of best practices and go with the blues and the greens. The new website's going to have research updates, patient resources, and much, much more. So as you can see on the right-hand side of the screen, this gives you a little sneak peek into the homepage of the new website. It's personal, it's patient stories, and it is a lot of content. So we're hoping that the website will bring you guys back over and over, because we will be updating the content quite consistently. So please look forward to that. We will make a big announcement, and we will share with you the day we're going to launch that, so everybody is in the know. I want to tell you about the ALK Positive strategy. Summer mentioned this in her introduction. When we look at our strategy for meeting the needs of our ALK community, we have developed 4 priorities, or we call them the 4 pillars for our patient community. Number 1 is research, right? We know that research is always number 1. It's at the top of the list. But in pursuing our mission for improving the life expectancy and quality of life for ALK positive patients worldwide, we also have our patient advocacy, education, and health equity. So we look at these 4 pillars when we are identifying projects that we're pursuing. We put each proposal, each project through the lens of our 4 pillars or our priorities. If it aligns with those, then we take it to the next step and see, we want the most bang for our buck. We want the most impact to our ALK community. So when looking at the 4 pillars, you can know any project that we are pursuing, it aligns with our 4 pillars. This is just a brag on all of you. So to date, from 2017 to 2023, these are the grants that have been given by the fundraising efforts of everybody on this call, the community, friends, family. This is because of you. So you can see through 2017 through 2020, total research funded has been over $7 million. You all need to give yourselves a round of applause for that and a pat on the back, because you have done an amazing job of fundraising for ALK Positive. I have never experienced a more dedicated, passionate, proactive group of people than the ALK community. So keep doing what you're doing. Now we can look at that $7 million, what we've funded, and it's not enough, right? It's just, when we're talking research dollars, those are big dollars. But you know, nothing is impossible for us, because together we're stronger. So $7 million, we want to crank that up and double that, you know, within 4 to 5 years. So, but we need everybody on board, and we need everybody as part of the team. And that's where it comes into LCAM. And we're going to talk more about that. We know that more research equals more life. That's one of our hashtags, our slogans: more research, more life. Our big goal for LCAM 2023, part of our strategy, is $1.6 million. Now, I know that that can look intimidating, but it shouldn't, because based on the successful LCAM campaign, which raised over $800,000 last year, we think we can double that. We believe we can make this. We already have $100,000 committed to donor matches for LCAM 23. And our goal is actually $350,000 in donor matches, so that we can double every dollar given for research. Projects we're funding. If you haven't heard, a letter through the support group, we have committed to another research grant collaboration with LCRF, Lung Cancer Research Foundation, for $2 million. Now we know the applications are in with the RFPs, and they're looking at those to see which of those will be the best recipients so that we can advance our research tremendously. Priority research projects, that's Dr. Ken Culver will be sharing those with you on this call next, so hang tight. We are truly stronger together, and we need your help. If we collaborate, if we come together, every dollar counts. When we look at those matches, every dollar turns into $2. So this is the time to jump on board and to put your fundraising hat on, or your ambassador's hat, which is as important to let people know about ALK positive cancer, right? People are not aware of what it is, but you have a voice, and we want to encourage you to use your voice to be an ambassador on all of your social media channels, in your private lives and in your professional lives. Let's get the word out about ALK positive so that nobody can say they don't know what ALK positive cancer is. Again, more research, more life. So it is my privilege now to introduce Dr. Ken Culver, who is the ALK Positive Director of Research and Clinical Affairs, and he is going to share with you our current priority projects for 2024. Ken, I'll turn it over to you.
Thank you, Lana. I appreciate it. So we could go to my first slide. I have 8 slides I'd like to share with you tonight. So it's a privilege to be back on ALKtALK. I missed my very first one, the last one, and I was really disappointed because they've been great. Can you go back, please? So there are 3 points I'd like to cover. First of all, I want to talk about the need and the opportunity for non-ALK based options, so non-ALK targeting options to complement the achievements and advances made with TKIs. Second, I'd like to talk about what we as ALK Positive are doing as with the expertise that's embodied within this organization to broaden the therapeutic options for ALK patients in general. And then finally, just an update on where we are in working with companies and researchers to expand patient clinical trial opportunities. So next slide. Now, you've probably seen this slide 1,000 times. If you were at the summit, you would have seen Alice Shah show this slide, but I want to talk about this slide in a completely different way than you're used to. On the left-hand side is to the traditional on-target resistance, as we all know. The mutations in the ALK target can lead to resistance to TKIs. And on the right side, it's all the other things that could lead to resistance. But there's a really important point buried in the center section that I want to highlight. So could you advance? This is an animated slide, so advance it. Oop, go back. Oh, the animations got lost. Okay. So can you see my pointer on there? No? Okay, that's unfortunate. All right, so if you look in the very center panel of this slide, you'll see there, right below, right above your arrow there, it's ALK in the blue blob. That is a representation that the ALK mutant protein that's driving tumor cell growth is inside the cell. Now, if you go up above, you'll see the ladder-like thing going across. That is a representation of what a cell membrane looks like. Well, look what's on top of that cell membrane. Right above the arrow, there's MET. If you move over to the left, you see HER2, HER3. And if you move all the way over, you see EGFR. So what this means is, unlike ALK, EGFR, MET, and the HER2 family, which is where we're part of EGFR family, are on the surface of the cell. They can be seen by the immune system. They can be seen by antibodies. That's a problem that separates and differentiates how you develop therapeutics for ALK positive tumors versus EGFR, MET, and HER2, for example. There are many others that are expressed on the cell surface. Unfortunately, if you look at all the proteins made in our human genome, 70% of them are like ALK. They're in the inside of the cell and not readily amenable to therapy. So what we as a medical group do is we want to recognize this is a challenge and see how we can make a difference. So let's go to the next slide. So there are 3 new strategic options that require you to know what's on the surface of the cell. And again, this is my modification of a slide that was used by Alice Shaw. On the very left-hand panel, you'll see what's called antibody drug conjugates. And if you look all the way to the right below the arrow there, you'll see that you make an antibody over in the upper left-hand corner of the diagram. Did we? Yeah, there. You make an antibody that binds to a known target on the surface of the tumor cell, and you couple to it chemotherapy. There are new therapies that are ongoing, and they are showing dramatic responses. It is the next wave, or one of the next waves of new cancer therapies. If we don't know what's on the cell surface of ALK tumor cells, we can't fully benefit from what are called ADCs. In the middle panel, it's a similar concept. You can see the radioactive signal. Again, you take an antibody or a protein, something that binds to the surface of a tumor cell, you add radioactivity to it, and when you infuse it into the patient, it selectively kills the cancer cells. Now, what else is really cool about this one is when you put the radionuclide on, you can put on one that's just for imaging. So you can take it and you can use it sort of as a tracer, infuse it into the patient. It will show, without dangerous radioactivity, it will show where all the tumor deposits are in the body with even higher specificity than you would see with a PET scan. Then once you know where it all is, you can now infuse the same marker for the tumor now with radioactivity that will kill it, kill the tumor cells. In prostate cancer, this imaging therapeutic technique has redefined the disease. Staging is changing because now they can see tumor they could never see before due to these new selective targeting therapies. We in ALK want to be a part of that. And on the right, bispecifics have been around, and bispecifics are basically antibodies that can hit two different targets at the same time. In this little example, you see in the bottom in the center, there's the antibody that's a Y shape. It's basically one arm is attaching to the tumor cell, one arm is attaching to T cells. And so the idea is by bringing T cells and tumors together, you can initiate an immune response. There are bispecifics that are approved. There are very exciting ones in development. Again, we need to know better what's on the surface of ALK positive cells. Next slide. Now, let me give you one example. This is a drug from Daiichi Sano, and they've got several of these. This is an ADC. And you can see right by the arrows, parturitamab deruxtecan. Now, that sounds like, oh, wow, that's a mouthful, and it is. But let me give you a little clue about how they name these ADCs. You can see the first part, parturitamab. Whenever that has an MAB on the end, that means this drug is a monoclonal antibody. So whenever you see that, whether you see pembrolizumab, right, you've seen it before. So in this case, parturitamab is the antibody. The next word is the name of the chemotherapy that's attached. So deruxtecan is a topoisomerase 1 inhibitor. And so as you begin to see more and more of these ADCs and these complicated names show up in your feeds and everything, and people talking about how great they are, that might help a little bit. This particular ADC targets HER3. Now, you may or may not know it, but EGFR is one gene in a family of epidermal growth factors. So HER1, which is EGFR, HER2, which you probably heard of in breast cancer and lung cancer, HER3, and HER4. Well, HER3 is thought to be expressed on 84% of non-small cell lung cancers. So Daiichi Sano is developing this ADC using HER3, believing that it is going to bind and kill most lung cancers in most people. Alice Shaw showed this slide at the summit, And you can see she highlighted on the right that there were 2 ALK patients that were treated in this subset who were resistant to TKIs, and you can see the mutational profile at the bottom. And they both had responses. One of them had a complete response. So the big question becomes, how often is HER3 expressed on ALK lung cancers? I can't find it in the literature. I've looked and looked, it's probably there somewhere, but how often is it there? And one of the things that plagues us as a patient group that we're really trying to tackle as well is there are 2 patients in this paper. There have been over 200 EGFR patients treated by Daiichi. So I'm meeting with Daiichi Sano in person in a couple of weeks at the European oncology meeting, where their lung strategy lead is going to share with me additional data they have in ALK. They want to bring this and others of their ADCs in to treat ALK patients. We need to know for sure that HER3 is just as common in ALK patients as it is in others. And so those are some of the key questions that we want to answer. But this is exciting stuff, and Daiichi is fully engaged with us around their ADCs, and we're working, I'll get the other companies we're working with shortly. Next slide. So when I joined the ALK Positive group about a year ago, one of the things that I really wanted us to expand on was our own work. What can we do as an organization that's not dependent on whether an investigator has time or a company thinks they can make money, but we know that we can do it. And so this problem, the ALK driver protein is only inside the tumor cell, unlike MET or HER or CD19, which we've all heard about in CAR therapy, or CTMA in prostate cancer. This is the problem, and it's a key problem that needs to be solved so our patient group can take advantage of the new therapies. Next slide. The situation is, as I've already stated, bispecifics, ADCs, radiopharmaceuticals, also called radioligand therapy, cannot be easily used for ALK tumors unless we know surface targets. Next slide. So we, the Translational Investigations Group, it's one of the groups in our medical committee portfolio. We're taking a 3-pronged approach. One, we're working with academicians at major universities to try to use their technologies to find out what cell surface targets there are on ALK positive cancer cells. Second of all, we're working with companies, and these by and large are diagnostic companies who have DNA and RNA on ALK positive tumors, where you can then, based on their genetic profile, sort of get an idea, are these genes likely to express proteins on the cell surface? And then third, we ALK Positive are funding a consultant arrangement with a bioinformatics group who's analyzing the millions of data points that are available in the public domain to see if we can get some clues as to the cell surface targets that we can use to correlate with what we learn from universities and what we can learn from companies. And this has already started. It's being led by Mark Muscovich, and we just got started. We're excited about how it's moving along, but we feel we have to go after every possibility to learn that. Now, next slide, there are costs associated with this, and I'm not able to give you, can you go one more? Okay, it got lost. There we go. It's hard to know yet what all these would cost, Lana and group, but I'm estimating, there's multiple projects with each of those, probably between $100,000 and $500,000 per project. It's our hope that by, 9 months from now, we're going to have some really good leads on this project. Next slide. Now, the Research Acceleration Committee excuse me. The Research Acceleration Committee is it's sort of our cornerstone of our medical committees. And what we're doing is in the highlighted blue box. We are talking to every company that we can get a discussion with, and that's a lot of them. You can see that there. We make a business case. Why is it commercially smart for your company to include development of drugs for ALK patients. Second, we're giving the clinical rationale. What are the benefits of working with a healthy, young population who have a long median survival? That's an advantage, not a disadvantage, and we're making that point. And three, we're letting them know there's still a major unmet need, and that can't be ignored. Just because there's it's the longest median overall survival of lung cancer subgroups, that's not good enough. We want to get to the curative side of things. So this just gives you an idea. We're working with more than this. This is just sort of the top line summary. Some that are, we're engaged with, which are first priority, second, third. We have some we're just watching. And then there are new companies coming on and off of this list all the time as data ebbs and flows across the biomedical research area. So that's next slide. Clinical trial committee. One of the things that we all have to make sure we realize is not all trials are created equal. And I don't mean about how much travel they have or what the toxicity of the treatments are. I mean, you have 2 phase 1 trials. How do you know which one is the right one? Because they're not the same. And so we are really trying to be smart about that. And so we're breaking them down. And there's this fantastic spreadsheet that Ellie has and updates up on our website. We're looking at them in sort of 3 buckets, and you can break them out in much more detail if you want. But there's this large pool of phase 1 trials that allow ALK patients. But in most cases, those phase 1 trials don't have safety data. They don't have efficacy data. They may not really know much about its work in ALK, but they allow ALK. And then you've got the later stage trials, and you have the ALK-specific trials that allow continuation of a TKI. And those are the ones that are we're most excited about, because you're staying on an active agent. Because remember, ALK cancer, like other cancers, has microscopic disease and has macroscopic disease. And we follow the macroscopic disease with scans. The microscopic disease is what you don't see, and continuing on a TKI, even though it hasn't controlled all of the tumor, maybe controlling a lot of the tumor. And so we're working with our key opinion leaders on exactly how to sort these out. But these are really key points one thinks about how trials are similar and different. And then finally, there are trials that allow ALK, but no continuation of an ALK TKI. And I just want to mention, the kinds of things we're trying to keep an eye on is there is a company who is enrolling in a trial for non-smoking lung cancer. All right, so they allow ALK patients. After a long conversation, I now know that they have no data on whether their drug can inhibit ALK and to what degree. And 2, they don't allow you to stay on your TKI. So if you decide to go in that trial, you don't have a scientific basis for why, other than that they're enrolling non-smoking patients. So this is an area where we as a medical committee are trying to clarify and be smart about what we do. Next slide, or what we recommend or what we talk about. So in conclusion, the treatment of ALK positive lung cancer is going to evolve, and it's going to be to non-ALK directed treatments. We need to be a part of that by defining what we call the surfaceome, what's on the surface of ALK positive lung cancer. Without that, we aren't going to be on the leading edge of these new treatments. Key clinical trials need to enroll rapidly. And finally, thank you. Without your support and, of course, the funding of these critical initiatives, we wouldn't be able to make these things come true. Thank you.
Thank you so much, Ken. You bring so much to the table, and I just saw some comments, Ruby, just that how great this is. So thank you for breaking that down. I think we're going to talk about fundraising, so nobody leave, nobody run away. Ken is going to stay here, so because we'll have some time for Q&A. So if you have any questions for Ken, he'll be here to answer those. So I want to introduce Katie Delaney. She is our development manager, and she's going to take you through how very easy it is to do fundraising without cringing. So, Katie, take it away.
Hi, everyone. If you haven't met me yet, my name is Katie Delaney, and I am the development manager here at ALK Positive. I am so excited to be here with you all, and thank you for allowing me on your ALKtALK. I am so inspired by each and every one of you, and I think we can all recognize that our personal stories are what enable us to raise that awareness to be able to fund for fundraising efforts. So I'm going to go over to the next slide. In our LCAM 2023 fundraising campaign, peer-to-peer, we have already raised $245,000 just from individuals just like yourself setting up a personalized campaign page through our Kindful donation center that creates a personalized link that you can share on Facebook, Instagram, LinkedIn, Twitter, and also be able to use in your email campaigns. We have an awesome lineup of already created and running fundraising campaigns, but we're encouraging you to sign up, share your story with your friends and family to be able to spread more awareness throughout your social media platforms. We have a platform called Kindful. All donations go straight into Kindful to be able to be processed with a low processing fee. If you click on our ALKpositive.org, our website, and go on to donate, there will be a drop-down button that says fundraise_2023. There you're going to find this button, create a team. You're going to choose create a team, and then fill in your information. You're going to then go to your email, confirm your email address, and then you're going to finish out those details, telling your story, the name of your campaign, and your information. I know that this might seem overwhelming or scary, and that's why over the last few months, I've been working on a ALK Positive fundraising toolkit. So we'll go to the next slide. In this toolkit, you will see a step-by-step how to set up a fundraising campaign. This makes it easy, and if you can't remember all of those fun facts from Ken's slides, I've created a facts about ALK-positive lung cancer that makes it easy to read, easy to share, and puts us all on a streamlined message to be able to raise that awareness effectively. This PDF is downloadable, and you can also separate those pages into easy printable PDFs that allow for great displays at your campaign if it is in person. We also have a fundraising Facebook group. Some of you may be already included in on it. We are going to be posting this fundraising toolkit along with downloadable PDFs on how to create a QR code and supporting materials that are just going to help raise those funds and be able to share your story impactfully and meaningfully. I am so excited to be a part of this team and be able to help you fundraise. That being said, any questions I am more than happy to answer, and you can email me at fundraising@alkpositive.org or directly message the ALK Positive fundraising group, and our fundraising committee team will be quick to answer any of those questions. And then we are going to talk about how to support your fundraising campaign by creating a patient story card, and that will be shared by Ivon Diaz, and she is joining us from a pre-recorded session up next.
Hi, everyone. My name is Ivon Diaz, and I live in London, which is why I'm coming to you via recording this evening, so I can spare you having to see me find the words around midnight my time tonight. So I'm an ALK positive lung cancer patient. I was diagnosed about 2 years ago. My professional background is in communications, PR, and social media, and I joined the ALK Positive Inc. board about 2 months ago, and I'm really pleased to be helping out with our Lung Cancer Awareness Month campaign. I'm going to be covering this evening, as Summer and Lana both mentioned, how social media can support our brand and our fundraising goals. So I'll get started. Okay, so on the slide, I wanted to show basically how we're using these social media cards. They're really here to help you with your own personal fundraising. They're also going to help us across ALK Positive Inc. to do all of our fundraising on our public social media channels. We'll be sharing all your stories. So really showing so many of the faces in our community is so important for that. As part of that, we realize an important objective is for us to create more awareness of ALK positive lung cancer, who can get it, and that we need more research. And that's why our campaign message is more research, more life. You'll see here a couple examples, which I'm about to go into. They're going to be using our new brand colors that will be launching in the new year. So in terms of the cards, so you can see them here, again, in the right colors, on brand, and really storytelling led. Probably one of the key things here is really the photograph, right? This is where we're showing our people, our community members. And so having an emotive photo of you living your best life with the people you love or doing the things you enjoy, it's really going to bring the stories to life. And really then having the 3 key statements that you want to include to kind of describe you as a bit of a person. And it's meant to be a bit surprising that this individual has ALK positive lung cancer. So here we have Mark Rosenweig's lovely card and photograph here with his statement saying he's grateful, hopeful, and living with stage 4 ALK positive lung cancer. We're also going to be asking you for a bunch of other information. So your name, where you live, where you're from, because really showing that ALK positive lung cancer impacts people all around the world from all countries is another key thing. If you're comfortable sharing your age, that might also be helpful because people often think that lung cancer is an older person's disease, and really showing that at any age you can be diagnosed with ALK positive lung cancer. And then other facts about your diagnosis, hobby, profession, pets, family. Ideally, the things you share are going to be somewhat related to your photograph. So if you are talking about knitting, if you have a photo of you in a knitting competition, or if you're sailing on the water, hiking, whatever it is. So please describe what's in the photograph, what you enjoy doing. Hopefully it's part of your picture. That would be a big help. We're going to be asking you what cards you need, which platforms you're going to be sharing them, so we know which sizes to cut them to, because the platforms do have different photographs and different sizes are optimized for those platforms. And we're going to be sharing them, as I mentioned, on our 4 channels across Facebook, Instagram, Twitter, and LinkedIn as well. So how to request the cards. This is really important, and it's actually very easy. We have a super simple, easy to use form. We even remind you what the cards look like so it can jog your memory while you're filling this in. So it's pretty self-explanatory. It's covering all the things I just went through, but also we'll ask like your name as you want it to appear in the card, your email address just so we can send you back your cards, and then all the other questions I was just going through. So please, Summer and Katie are going to be putting the link in the chat this evening, and we'll recirculate it after the call as well, so you can request those cards. It is a 2-step process. Unfortunately, you can't upload your photograph to the form, so please then, after filling in this form, send us a high quality image to networking@alkpositive.org. And I'm going to cover now some top tips. So ideally for your personal fundraising, what you want to do is to create a month-long campaign. You can start before Lung Cancer Awareness Month, by the way, if you wish. But ideally, if you're doing it specifically for LCAM, then please do start on or around the 1st of November. Ideally, you would start with a post that explains your story, right? How you were diagnosed, anything about how you felt, how the role of research, why it's important to you, why lung cancer awareness is meaningful to you, and really inform your followers, your audiences, your connections, your friends and family that you're going to be fundraising for ALK Positive Inc. And if you plan to be sharing posts regularly or updating them on your progress, it might be good to let them know that. So why they're seeing all these posts for you suddenly. If you're not posting about Lung Cancer Awareness Month, you might feel unusual, but so that might be helpful to tell them, I'm going to be doing this month, and you can share other people's cards as well. And then that's it. And really, I'll be covering a few more things, but you can update them on your progress and how you're doing on your fund. So, as I was saying, the key thing here is regular engagement can be really helpful. So whether you decide to do it daily, every few days, or weekly, frankly, you may also just want to do it once and be done with it. So whatever is right for you is the right way of doing it. So don't feel any pressure. You should do it in the way that is meaningful for you. If you do want to engage more, an easy option might be to share other people's stories. Different platforms do this a little bit differently, but like in Facebook, you'll see in any post we put out from ALK Positive Inc., there's a share button on the bottom. And if you just hit share, you can send that on to your community, and you can write a caption if you wish, particularly if you know the person. It might be nice if this is someone you know from our community, you can say something about them, or you can just use the hashtags and be done with that. Which brings me to, it is important to use our hashtags, and also ideally tag us if you can. So when you're writing your post, if you put the @ symbol and you start typing ALK Positive Inc., you'll see our organization's name come up. Please do tag us. Use the hashtags, as I mentioned. For more research, more life, I recommend you capitalize the first letter of each word. That way it stands out. It's much easier to read, frankly, rather than a small jumble. And use LCAM, LCAM, because it is Lung Cancer Awareness Month. There's so many different organizations, medical communities, different charities that are all talking about this disease, and it's really important to be part of that wider community to show the faces of lung cancer together. So it is a nice time to unify with the others as well. And finally, do stay informed. We are going to be doing some posts in the support group, thanks to Rhonda and the other administrators. But we do have a special fundraising group for those who really want to get into it and discuss all details. It's called ALK Positive Fundraising Ideas and Research Updates. Do join that group if you're not already a member. We're going to be sharing progress when it's Giving Tuesday, if there's special gift matching, to really encourage you and your followers. So do join that group and stay informed. You can send us any cards and any questions rather you have on social media or on fundraising to these 2 email addresses there. So the one for specific to social media, do send them to networking@alkpositive.org, and send any questions on Kindful or fundraising, specifically to fundraising@alkpositive.org. If you get mixed up, don't worry about it. We'll share it to each other. So just get in contact, okay? Obviously, Lung Cancer Awareness Month starts on the 1st of November, but it's never too early to start. So really encourage you to please request your card today. It will be a big help to us to have a bunch of cards ready to go for the 1st of November. So please don't wait. Help us get as ready as we can for this big, important moment in our year. So thank you so much for all you're doing to raise awareness, support fundraising, and really support all of our fundraising goals. And with that, I will hand it back to Summer. Thanks so much.
Oh, that was great, Ivon. Thank you so much. And thank you, Lana and Katie and Ken. This has been so awesome. I just wanted to share with you all, in case you don't know this background of me, that I hate fundraising. I probably shouldn't say that as an ALK Positive board member, but I will be honest and keep it completely real. I am guilty of doing the buyout for my kids' football teams, cheerleading. Let me just buy all the candy bars. Not like I have extra cash for candy bars. I live in Hershey, but I don't want to fundraise. However, we have come to the point where it is life or death, right? Let's again keep it completely real. So our lives depend on this money. Ken laid it out there. Here's why we need it. So for somebody who does totally dislike fundraising, I want to tell you, I think maybe I was diagnosed in the summer of 2020. That November, I kind of took off a little bit. But then we did a walking fundraiser that May. And I decided, when you're first sick, I'm sure you can all relate to this. People come out of the woodwork. Everybody wants to know how, why, how did you get lung cancer? I heard Harrison's mom has lung cancer, whatever, and they all want to help. They bring dinners, they rally, and we're fortunate. Or you might be somebody that kept it kind of close to the chest, but the bottom line is people are concerned, they want to help. then time goes on. All of a sudden, you're not on your deathbed anymore and you're looking pretty darn good. And we talk about in our groups, you know, that people are like, really? You know, wow, you look so good. You don't look like a lung cancer patient. We hear all of that, right? But again, people do still really want to help. So maybe you don't need dinners anymore. And maybe you don't need rides for your kids or help taking out the trash or whatever it might be. But what do you need? You need dollars, and you need them yesterday. We need to push these projects. So that May of 2021, I quickly gave an update to my story. And again, I'm not really a huge social media pusher. I'm not, you know, I like to sometimes post about my kids, but and I gave an update about myself. I shared my story. I made a Kindful account. It was very simple. And within 3 days, I think I had $8,000. And whether it was 200 that I raised or 8,000 that I raised, it made a difference. It was $200 more. It was $8,000 more than ALK Positive had a couple weeks ago. So people were rallying. It was almost embarrassing. Let me be honest. People and the comments, and you're so inspirational and you're this. And that wasn't why I told my story, right? I didn't need a pat on the back for getting up every day with lung cancer. But who cares? I did it. I shared it. But I also want to say, if you aren't comfortable with that, if you don't really want to share your story, ask your sister to share your story. Ask your best friend to share your story, because it is going to hit home. Because as we all have learned, there's a lot more people out there like us than you know. And they maybe don't have access to this or have a group to join, but they might find solace in your story, or maybe they lost a parent and they find that they want to give, or maybe a cousin or something. So we're a lot more relatable than we think. My husband is, you know, likes to live off the grid. He does not do social media at all. So if that is one of you, again, reach out to somebody else or send an email list or have somebody do it on your behalf. Because as somebody who raises dragging my heels in the mud, I did do it, and you can do it too. So I don't know, Lana, if you have anything else you want to wrap up, or if we want to just take some questions. What do you think?
Let's take some questions. I want to say one thing is about, we've had a lot of questions about the Facebook fundraising. So let me address that just briefly. Is we have been working on our Facebook fundraising, the platform, for about 6-7 months. Facebook went through and not suspended, and didn't delete, but took our accounts, different accounts off. And it was a paperwork error. And so that has been corrected. And we have been tirelessly reaching out to Meta and trying to get back onto the Facebook fundraising platform. I know that it's so easy for everybody. I agree, like for birthdays and everything. It's so easy to put a Facebook fundraising. We are working on it. They are moving, I will let you know, to PayPal fundraising now, which we did. We've got our account ready up on the platform. So if you are not transitioned your account, then your account will be deleted on Meta, but we are good. Instagram, you can always do an Instagram fundraiser. That is up there. It works the same way that the Facebook fundraising does. But really the Kindful platform, because we have all the resources there, are really great. And I see Ruby, that is great. A tutorial or be directed to a video. Yes, Ruby. So I would, Ruby, if you would, and anybody else, reach out to the fundraising at ALKpositive.org. We will get back to you quickly. And that is a great suggestion. I will say that if you go through the fundraising toolkit that Katie has created, you're going to get a lot of those answers. There's a glossary in there, so you can take a look on there. But I just wanted to address the fundraising, the Facebook fundraising question, because that's been something we've been asked quite consistently. So take it away, Summer.
Okay, thank you, Lana, for touching base on that. Let me just go through here. I don't think we had too many questions actually, so feel free. Hopefully you all saw Katie's links. You can even copy and paste that if you want onto another document, onto an email to yourself so you don't lose those links. And again, we're going to be sending out an email again with the YouTube recording of this session and with these links again listed so that you will have them. Let's see. Yes, ADC does bring us new hope. So I was getting so excited listening to all that research.
I think Matt Young's question, Summer, is
Thank you.
probably the most important question here is, and Matt wrote down, what is the ALK research group using as a selling store to get more pharmaceutical companies and colleges to focus on ALK research? So I know Ken kind of hit that a little bit, but if I'm selling if I post something or if I talk to a friend of mine, or, I mean, Ken, what does my dollars do in the short term for a person who's had this for a while? And I think this can roll into Matt's question a little bit.
Yeah, Matt, thank you. So we really are taking a four-pronged approach, right? The first one is we need to let them know that ALK isn't a rare disease anymore. That there's an estimated new 10,000 cases a year, but because of the median survival of 7 years, that means there's 70,000 people in the US that are thought to have ALK positive non-small cell lung cancer, and the three companies, Takeda, Pfizer, and Genentech, are making over $2.5 billion. So no company can say, oh, we can't make our money back if we invest because we are no longer a rare disease and we need to take rare out of our lexicon because that gives them the impression that it's not worth investing. Second thing we're doing is we are saying, a lot of companies will say, well, people live so long, it's so hard to get an answer. And one of the things that's really important to me is you take things that people see as a disadvantage and you make them an advantage. And that's exactly what we've done here is we've said there are lots of ALK patients that are living an average median of 7 years, but they still have measurable cancer in their body. They can see it on MRI or on PET, or they have circulating ctDNA. You don't have to wait until people's cancer comes back. You can treat that residual cancer and to make them a no evidence of disease. And a lot of companies are buying that explanation because ALK patients are young. ALK patients don't have many comorbidities. ALK patients don't have a smoking history and pre-existing lung. All those things we're making as a positive because they are. And then third, the thing we're doing is we're making it clear that yes, TKIs have done a lot, but if you look at their survival curves, it's not everybody's making it to 7 years. And so there's a big unmet need in the short term and in the long term. And then finally, the anchor to all this is our patients telling their story to the companies. We were on with a man who's been involved in biotech and pharmaceuticals for years. And at the end of the conversation, he said, in all those years, I've never met a patient. It was on our Zoom call with that man was the first time he met a patient. That's sad. One of our obligations is to make sure that they know your stories so that everything else comes into focus.
Thank you. That is huge. Amazing. How about, I'm not sure who wants to field this one, maybe Lana. How does this all work if you're outside of the US?
That is a great question. I'll again be very transparent. We have had some issues in the past with the funding between with the receiving of the funds when it's outside the US. I believe that we have those barriers broke down now, and we have a platform that receives those funds so that we're able to get them and then put them directly to research. So if you're outside of the country and if you have some questions about that, please reach out to us because, of course, every country is a little bit different. but we will help you navigate through that so that those funds can go into ALK Positive Inc. and go directly into research.
Wonderful. Thank you. Anybody else here? I was just scanning quick. Yes, Ivon, I totally agree with you. Excellent points. Ken, we are so lucky to have you in our corner and fighting for us. And the whole why not ALK, don't overlook us. Let's keep it going. So that is
I'm going to rant myself. After your summer rant, I'm just gonna say, look,
please, go on.
I've been doing this for 9 years, right? It's my 10th year going into it, and like you, I'm not a big fundraiser, but the thing that I think people have to realize is that we have matching dollars, and once someone hears that, the $10, $15, $20, people like to give and they want to give, but they think they have to give hundreds of dollars. But if they just give 10, 15, it adds up. So, Lana, how much matching dollars do we have again?
Right now, we have $100,000 in matching funds, and our goal is 350,000. So right there, we've got 700,000. If we reach those matches, we'll have 700,000 towards our 1.6 million. So we'll be able to make it, but we do need matching funds.
Okay.
And I think that's another call to action then, right? We need, if you know somebody, you have a great aunt that, has some funds she wants to donate. I don't know, but again, right, that is a great point that we do need those matching dollars. They're a great encouragement, Mark. I agree. Any last questions?
Anna.
Lana, Katie, Ivon, you put together an awesome campaign. Thank you so much. Mark, go ahead.
There's a question here about, do we have a breakdown of how much goes to research and how much goes to administration cost, or anything that would help us sell to our friends and family, what the breakdown would be?
Absolutely. So just so you know, because that is a really important question, we are on GuideStar, which is the platform that shows the fiscal transparency of nonprofits. We are at a gold level right now. We are just a step away from being a platinum level, which lets our donors and the organizations donating to us know that we are a fiscally responsible organization. Right now, we're waiting for our 2023 audit, which we should be receiving within the next 2 weeks. That will give us a good firm number. Right now, it looks like about 83 cents on every dollar goes to research or mission. So ALK Positive is utilizing those funds to fulfill our mission. So there's not a lot of organizations out there that can say 83 cents per dollar go to what they're fundraising for. So we're very proud of that.
That's amazing.
That is great. Well, thank you all so much for coming. Mark, I don't know if you have any.
Why don't you just give us an update on the next ALKtALK?
That will be coming October 29th, I believe. So you have a couple weeks off. Then you can grab your Halloween candy and cozy up to us at 7 p.m. Eastern time. And we will be joined by MD Anderson's Dr. Elliman. He will be giving us a refresher on local consolidated therapy and his Bright Star trial, and talking about who's a candidate for LCT, when's the best time to get it, what are the results of his Bright Star study, and what's happening with Bright Star 2. So yeah, we'll be talking a little bit about radiation and other options there. So that will be very exciting. And then we'll give you another sneak peek into November and December. But as I'm sure some of you heard, Nuvalent will be back with us. And Kirk and I are actually trekking out there to Cambridge in a few weeks. So we will be joining the Nuvalent team, and we'll be excited to bring back and share with you some stories. So yes, that is in our future.
Thanks, Ken and Lana and Katie for joining us, and Yvonne, and we're looking forward to it. So.